Good evening, friends. My name is
Good
Rejani
evening.
Biju.
Good
Good
evening,
evening, ma'am.
Good evening, ma'am.
Good evening.
Good evening.
Good evening, ma'am.
As you all know that we are doing listening now. I'll be taking a class of listening part B today. So welcome everyone, and before going to our session, I request everyone can add the people to our platform. Still, yesterday one of my friend asked me that I thought father was collecting money, that's why I did not join. So many are not aware that it is a free platform. So it's our duty to inform them. Okay. So even though we say that it's free platform, they won't believe. But if you tell to your friends, they'll believe that. So that as you are getting the service from the father, ultimately free, others also have to get it. So know that. Let everyone be blessed, right? Let us go to the session. OET Listening Part B. Our mentor Father Celine Joseph has very beautifully designed for 7 steps to practice listening, and this is the ultimate way of practicing. So you know that what are the steps. I'm not going to explain, but I will just see what are they. Step 1 is do the test under exam condition. Whenever you are practicing, you have to do that under exam condition, like we are writing in the exam hall. Second step is refer the key and identify the mistakes. So after doing, we have to go through the key and we have to correct our paper. Then we have to find out what are the mistakes. Third one is record your scores on self-assessment form. Hope all of you know about the self-assessment form every day. Along with the task, Sunita, our chief admin, will be posting the self-assessment form, updated form. You have to take the printout and you can enter your score there. Then listen to the audio again and try to identify the answers and related strategies. Yes, that is the fourth step. You can again listen and what are the strategies used in that to identify the answer. You have to see. Then again, step 5 is listen to audio, read the script, mark the answers and highlight the related strategies. And the step 6 is detailed analysis of the audio and script to understand the strategies involved. And the 7th step is that analytically listen to the same audio repeatedly for a week. See, everyone may have doubts on this one. Why we have to listen it for a week? From my experience, I can say that, see, I also was thinking like you people, why should listen for a week? It's enough to listen one audio one day, other audio other day. No, it's not like that. So whenever we are listening, you know, our brain will be getting adapted to that particular tonation or what we call accent around. Okay, so that it will be very much helpful for us, and we'll be able to identify most of the words, pronunciation and all. There may be some variation, so it will help us to learn thoroughly. Okay, now let us see some important strategies we have to follow. All the strategies father has explained very well in all the videos, and I'm not going in deep. I just reminding some of them, especially doing listening part B. What are the strategies we have to focus on? They are here. You can see that most important strategies: synonymous language and paraphrasing. That is the main thing you can see in part A, B, and C. Okay, in the listening, if we are waiting for or yeah, we are trying to get the same words in the question or answer option, we may not get it. So we have to understand what is the meaning, and we have to listen the audio. And other important strategy in listening, contrast word. Okay, so as it is very important in the reading, it's very important in listening too. After contrast word, what they are telling in the audio or explaining, you know that there may be, if any option is matching with that, it may be the answer. Okay, then scale, verb, and negative expression. Yes, negative expression is other thing. You know that they may be telling the same option what is given there, and last they may be using some negative expression, so that we may not, if we did not listen each and every word, we may miss it, or something like are in, I mean, is in, within, all those expressions, or none, never, all those things. So it's very important. Again, you know that we have to focus on the keyword, hedging words in both the questions and answer options, differentiate options and prioritize. That we know that whether has there's a beautiful video explaining about this listening part B, and in that somebody already commented that without listening the audio itself we can do it. Yeah, there are some options we may get in such a way, some questions and options that we can differentiate the options and we can prioritize which one may have more priority. Okay, and when listening, it will help us. Again, possibility of more than one right option. Yes, there may be more than one right option, but we have to choose the correct option so that these contrast words or model verbs or scales or anything may help us. Then listen audio carefully and choose the correct one. Then the next one is word used to express or describe the feeling or emotion. That's important. We know that sometimes when they are, if it is dialogue and all, they are, when they are telling that they may be doing some expressions like, oh, it was so horrible, or they may be laughing, or they may be expressing, using some expression words that is with that, you know, that anyway, for example, if they are telling that they are regarding any research study and all, and finally they are telling that anyway it was the result was awesome. So with from that expression, you can understand that it was the positive or it was successful. Okay, so they are like that from the feelings and emotions. Also, we can understand what they are meaning. Okay, pay attention to signal words and listen whole. That's very important. We cannot miss a single word. We have to listen whole audio. When we are listening, we may feel that, oh, this is the correct answer. And if we avoid or neglect the remaining part of the audio, we may choose the wrong one. So it is very important that we have to the whole. Okay. Now we'll go to today's. We are going to do it. This is already given last week in the task. Okay. You can see that the question is the question number 25. You know that it is there will be 6 questions and each will not have any connection in between. It may be different topic. Okay, like reading part B, and it may be monologue or dialogue, and there may be 3 options. You know that while going through the question and the options, what are the things we have to mainly point out. That's what highlighted here. That means the heading word or the keywords we have to see. So we will be getting a the question, you know that you will be getting the time to read the question and answer option. Then the audio will be played. Then we'll be going to the other question. So you know that's the advantage of the listening part. We will be getting one by one audio. So it will be more easy for us. Okay, question number 25. You hear a nurse briefing her colleague about a patient. What does she want her colleague about? Here you can, you know, that most of the time when we are taking over or when we are handing over, you know, that will be what we are doing the same thing. Maybe you can listen here too. And the question is, what does she want her colleague about? But one is important. Okay, then when we are listening, we have to listen. I think they are telling to do what we call it is necessary to do or must or any obligations like that or words used like that, then it will be helpful for us. So warning will be always, you know, that we'll be giving, it is very important to notice, or we'll be telling that you have to listen or you have to not, you should not forget. We also will be telling the same when we are giving handover. So it's important, you should not forget this thing like that. Okay, now we'll go to the audio, then we'll listen what is the correct answer. Before that, let us see the options. Option A, the patient is allergic to some type of antibiotic. The keyword in option A is allergic. And the option B, care must be taken to prevent the patient from falling. So here must is highlighted in other color. In that I already told that one it may be and they may be showing what the in the audio they may be telling that it is very important, so that the word must is used there. So that is another clue for us. Again, what they are warning, if it is the option, what they are warning, care to prevent the patient from falling. Okay, and the option C is oxygen may be needed, and it is given there after that, if the patient become breathless. So what we have to concentrate while listening the audio, are they telling about any allergy, or are they telling that the patient is in a risk of falling, or if the patient is breathless, how to give the oxygen. Okay, Let us listen the audio.
Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness, and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago.
Excuse me, Rejani, audio is not audible.
She's at high risk.
Can you raise the sound?
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness, and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable. Oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay, hope you heard the audio.
Yes, ma'am.
Then,
yes, ma'am, but it was
what?
not very clear.
Yes, ma'am.
Okay, what do you think? Maybe the answer? Which
B,
option?
ma'am. B.
Can you say?
B, maybe B,
Yes,
because
ma'am.
it was not very much
Yeah.
audible.
Maybe B, ma'am.
In the
Yes.
A
B,
part,
ma'am.
it is telling patient is allergic to some type. He is not allergic anything. Second one, there is already she had a surgery, so she is high risk for fall. So to that one she's empathizing. I mean, must to what she's telling. Third one, her vital signs is stable with a saturation of 98. So no need of oxygen. So I thought I choose B option, ma'am.
Yeah. So here you can see the script. So let us see the option. Here you can see that option A was allergic to some condition. Here they are in the audio, they are telling she is on a regular diet and has no allergies, not telling even any medication allergy to. And option B, you can see that she's at high risk. The word high risk, it is showing that it's a warning, right? So why they have used the word? Because we have to be very careful. So that's a warning. So she's at high risk for fall due to her dizziness. They are telling that due to her dizziness. Explain it there. Again, regarding the IV antibiotic allergy, it is option A. Here it is telling that IV antibiotic to which she is tolerating well. So tolerating well, that's also showing that there is no allergy. And option C is mild shortness of breath and wheezing, and already oxygen saturation is 98%, 1 liter. What is 1 liter mean? Patient is already on oxygen 1 liter. So the option C is also not a correct answer. So here you can see that. So if the patient become breathless, the oxygen may be needed if the patient become breathless. Here already it is given that patient is having 98% saturation, and they are telling already on oxygen, 1 liter of oxygen. So that is not the option. So here you can see how it is connected. One, so that in the option B it is given must. It is showing the necessity, and also in the audio they are telling high risk. So allergy and other two are not the answer. Hope it is clear to you. Can we move to next one?
Yes, ma'am.
I think we can move to question number 26, right? Question number 26. You hear the manager of a care home for the elderly talking to the nursing staff. Okay, care home for the elderly. That is the context telling us. Then the question is, he says that errors in dispensing medication to patients usually result from. Errors result from. So what is the reason for the error? Okay, result, you know that it means reason for the error. Let us see. Option A is interruptions while calculating dosage. Option B is a failure to check for patients' allergies. Option C is administering drugs late in the day. Here, we cannot prioritize it like the previous one, because anyone may be the option. So we have to listen the audio carefully. Then we'll get the idea. Okay. So interruption calculating, failing to check allergies, administering late in the day. Let's see what the audio is saying.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning, afternoons, or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Option A, ma'am.
A.
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 Okay.
A stands.
Interruptions. Yes. A is the answer.
Instead of interruption, they're using disturbance.
Yeah. Okay, let's see the script. They are telling mistake being common in the morning. So that is opposite of one option. What is that? One option given that it is late in the day. Here it is telling that
Comparison.
common morning, that afternoon, than afternoon or evening. So options can eliminate in the beginning itself. Again, it's coming to being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please try to avoid distracting your colleague while they are doing this. So from that we can understand that option A is the answer. Again, option B is telling that drug interaction, side effects, and patient sensitivities. And there is an expression, fortunately. That means we haven't had too many problems of this nature. So that is not the. So option B is about that particular thing, and that is not the answer. So here you can see that interruptions. The word used in the audio are disturbed, distracting. All are the synonyms of interruption, right? And again, in interruption in what? In calculating dose, here it is telling that working out and preparing doses. Okay, so that is calculating dosage. Synonyms used there also. Again, next, here option C, I already told that it's a morning, it is given in the audio, and late in the day, so that it is opposite option. And then again, the allergies, that they are telling that kind of problems are not there. Okay, so fortunately that expression while listening itself we can understand that that is not the answer. Is it clear? Yeah, let's move to next one. Question number 27. You hear part of a morning briefing on a hospital ward. Okay. Question is, what is the plan for the patient today? So plan and today both are important here. Okay. Option A, her emotional state will be carefully observed. Emotional state to be observed. Again, she will be transferred to a more specialized unit. Transferred. Again, option A, C is a social worker will come to see what help she needs. So while listening, again, no need to look on the options or questions and all these. That's why these keywords we have to highlight and keep it in mind. And we have to just close your eyes and listen the audio if you have problems with multitasking. Okay, so because from my experience, I'm telling when I'm reading and listening and writing, it was a problem for me. So what I'll do, I'll underline the keywords and I'll listen the audio. Okay, maybe by closing my eyes, so that you'll be able to understand. Okay, now let's listen.
B will be the time.
Question 27. You hear part of the morning briefing on a hospital ward. Now read the question.
Great. So overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilization of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for legal guardian may be required.
Right. We'll consider that at tomorrow's ward rounds.
Did you get the audio and are you able to find out the answer?
B, no?
Option A.
B.
Ma'am, option B.
B is the keyword is transferred. There they are
Yes, ma'am.
A.
but
A or C can be the option.
Ma'am, B.
A, ma'am.
B, B.
yeah.
A.
Now let us here is the
Yes, to the man. She is not.
script you can read now and you can find out what is the answer. Okay. Here you can see she has history of poorly controlled paranoid schizophrenia. She presents with a chronic persecutory and paranoid delusion and all significant thoughts. Overall, those things are telling what?
Plan for discharge.
Emotion.
Plan for discharge.
Emotional disorders.
Yeah, yeah.
Emotional
Disorder.
Yes.
Okay. Again, it's telling that we'll be observing her every 15 minutes and monitoring the level of distress, psychosis, and any response to interventions offered. So that too, telling that she is having some emotional imbalance or the distress. Again, that is the option A, and option B is to remain in high dependency unit given here, and it is given. I'll show you.
Transferred in the option. Yes.
Yeah, transferred opposite it is to remain means. Okay, remain means what? Yeah. Where we are, where the patient is, let her continue there only. Okay, transferred means it's opposite. So that's not the answer. Option B. Now again, regarding social worker, they are telling, but you can see that social worker interventions required for placement and community support options, and that's been looked for tomorrow. That's why I told that. We have to be very careful. The question keyword plan for today, right? So that is not the answer. Option C is also not the answer. So emotional state, you know that in the beginning, like father is telling that the topic sentence, so in the
Tail
beginning
expression.
and they are telling about the emotional state and also giving more description regarding that or explanation regarding that only. Okay. So yeah, observed. Here it is given will be observing her every 15 minutes. So that is an important thing. So that's option. Okay.
So the audio
Hope
is
it is
not
clear.
Audio is
Can we move to next one? Can we move to next one? It's clear now?
Yes, ma'am.
Yes, ma'am. It's
Question
clear.
20. You hear part of an antenatal consultation at a GP practice. Question is, what does the patient want to know about? What the patient want to know? What is the patient's concern? Okay. Option A, the advisability of a home birth. Then B, ways of avoiding depression. C, what killers might be available during labor. So what we have to keep it in mind? Advisability of home birth, the ways of avoiding depression, postnatal depression, and what painkillers. Okay.
Painkillers.
Yeah, let's listen now.
Question 28. You hear part of an antenatal consultation and a GP practice. Now read the question.
This is Summer. How can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it.
Going without wouldn't put me off then.
An epidural's out, I'm afraid, because we can't do it without an anesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Are you able to say?
B.
Can you play it again, ma'am? Please.
It's not clear, but B, I think. According to me, it is B.
Do you want me to play it again?
Yeah, that is
Better,
not clear.
yes, ma'am.
Gate. You hear unrequired.
Right.
Gate. You hear part of an antenatal consultation and a GP practice. Now read the question. This is Summer.
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off then.
An epidural's out, I'm afraid, because we can't do it without an anesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
C.
Option
I
C,
think
ma'am.
option
They
A.
are speaking about pethidine painkiller.
Option A,
C,
ma'am.
ma'am. C.
Okay, let's see.
C, ma'am.
Yeah. Here you can see that the highlighted one, because of time problem, will be going through the highlighted one only. But I am determined to be at home this time to feel more relaxed as well as
Yeah.
safe.
Option A. Yeah.
What is the meaning of that? More relaxed and as well as, that means that's not a concern for her, right?
Yeah.
Yeah. She is agreeing that she is ready for the last time. Here they are telling that she is telling that last time the previous birth, somewhere it is there, was in the hospital, and now, yeah, here, yeah, though everyone on at me about going into the hospital, I had my, what is that? Yeah, last child there. So she was telling that last time it was hospital birth. Now, but I'm determined to be at home. That means she is comfortable with that. This time to feel more relaxed as well as safe. So she is thinking that that is not that's not a concern, or that's not a problem for her. She is prepared for that. Again, there's a contrast word used, but I wondered about an at-home epidural if I wanted it. So that's epidural means, you know, that he's asking about the painkiller, right? And they are telling that GP told that an epidural is out, I'm afraid, because without anesthetist, you know that we cannot give epidural. At home, it's not possible. Then he is suggesting just pethidine or gas and air, but they are very effective painkillers, and she is agreeing to that. Yeah, pethidine is good. Okay, so that is option C. Again, they are speaking about option B, a bad patch. That is postnatal depression. You know that that is mentioned as a bad patch. What she is telling regarding that?
Last time she had.
Yes, and I got really depressed. I couldn't understand it. It was short-lived, though. I'm better prepared now. So, do you think it's a concern now? She said she is confident that she is prepared now. It can't be prevented. I have read up by coping strategies. So she is prepared for that. It may happen, but she is prepared. So what is her concern now?
Ma'am, home delivery.
Painkiller. Yeah. Yes,
Painkiller.
Yes, you can see that. Want to know here, want to know, here it is said, but I wondered about the expression wondered about. That means she wanted to know about something. Third means every time it's not meaning that it's that she's surprised. Okay. English words are many meaning, you know that. So it's what she wanted to know, showing there. But I wondered about an at home. Okay. Now again, you know that advisability at home birth, we have seen that she's already determined. So if it is determined, no need advisability, right? After determining something, after taking a decision, we won't ask an advice, right? Yeah. So that's the answer. Again, ways of avoiding depression, we have already seen that she's telling that I'm prepared. So that's not the answer. What painkillers might be available during labor? She is concerned about the painkillers available, and they are explaining more about that only. Okay, and epidural she asked, but epidural is not possible, but he is giving some other suggestion like pethidine or gas, and she agreed with pethidine.
Option C is the answer, right?
C, C.
C.
Yeah.
C
What?
is the answer.
Yes, C is the answer. What painkillers?
Yeah.
You got no?
Yes, yes.
Okay. Now, question number 29. You hear doctor telling his supervisor about a problem he had carrying out a procedure. Problem to carry out a procedure. Let's see. That question. The trainee feels the cause of problem was. Now, there's a problem. We have to see what is the cause. He is explaining. Okay. Now, option A, treatment administered previously. That means previous treatment. B, the patient's negative reaction. C, inappropriate equipment. So, okay, these keywords, keep it in your mind and listen the audio now.
Question 29. We hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, she endured it without a murmur. I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Option A.
Here, treatment administered previously. Why? Okay,
Negative reaction. Inappropriate equipments he did not use, no ma'am.
Yeah, that can
And
be.
the patient, the second option is patient negative reaction. Only the talk is going between the trainee and the supervisor.
But the option A is talking about the treatment, no? The question is asking about the cause.
Previously, she has received the same investigation they have done, but again, same only. I feel maybe I am wrong. I don't know, ma'am. Just
You're repeatedly
you are
done on same area.
You are correct. A is the option.
correct.
Something was done earlier, but that was not. I feel also A.
Yeah, please wait. I think she's having some network issue.
Okay, ma'am.
Okay, see here you can see that the context we have already highlighted a problem carrying out a procedure, and the question is cause of the problem. Okay, so here inappropriate equipment, anyway, as you said, it is not given, so we can eliminate that. Other two are the patient's negative reaction. There they are clear. He is clearly telling regarding the reaction. I don't know whether you are able to identify. Okay, I'll show you the script. You will understand. Again, treatment administered previously. Okay. So what is the here you can see that carrying out a procedure. Carrying out a procedure is the context. So you which one correct answer do you think?
C, ma'am.
C.
Equipments.
A.
B is the answer.
Here the
Equipments.
patient's negative reaction is not we can we know that here carrying out a procedure means we will be carrying out the procedure, right? The nurse trainee doctor is facing the problem to carry out the procedure. Okay, now let's see the script. He is telling that a problem taking blood. So that's the problem. Now let's see. Done that procedure numerous times now. So if we are practiced many times, we won't have any particular problem. That means he is also has done numerous times. That means he is not bothered about doing that particular procedure because he is experienced. So I wasn't particularly worried. Again, he is telling difficulty finding a vein. Yeah, there he told the reason. Difficulty finding a vein. Now we have to see. I mean, he told the problem. We have to see what is the reason. Difficulty finding the vein is the problem. Now we have to see what is the reason. Here it is given collapsed vein. How it is given? I suspect her illness means she'll have had a number of cannulas inserted. Have had a number of cannulas inserted means
Many.
They have attended many times.
Many times.
From the tense itself, we can understand that have had means there
Many
they were going on doing inserting it. So it was going on doing. That's why what happened then over the week she's been here and that's
Collapse.
yeah. The another important word is given here, a keyword that is led to. Led to means leading to something. That means result of something, right?
Yes, outcome of the procedure.
Yeah, difficulty finding vein. That is the problem. See how it. What was the reason? They are telling that it was because of the continuous insertion of the cannula. Veins collapsed. So collapsed vein is the reason, right? Now. Option B, patient's negative reaction. What he told about that? He endured it without a murmur. So without negative expression, I already told you in the beginning that negative expression we have to be very careful. Without a murmur. That what is the meaning of that? Whether the patient was negatively reacted or
No.
Not reacted.
There is no complaint.
so yeah.
No complaint, silent.
No complaints.
Without
Yeah,
murmur means
positive.
no complaint.
Yeah, opposite
She
statement,
accepted.
right? Yes,
Except
opposite.
she was
Yes,
silent.
that is opposite statement. So
without any complaint.
here you can see that. Okay, I already explained the cause of problem. Have had a number of cannulas inserted. Okay, father will be telling now about the cause and effective language and all. Here it is given carrying out a procedure. It's a problem they are telling. A problem they already given in the context and carrying out a procedure. And the question is cause of problem. And here they are telling that what is that? Have had a number of cannulas inserted. So treatment administered previously is the correct option. So previously means here the expression previously it is given that have had a number of cannulas inserted means inserted number of cannulas previously, right?
Yes.
Yes.
Treatment treatment actually it is not a treatment. It's not a sometimes it's not used as a medical term here. Or the OET English language we have to understand that sometimes what the exact meaning of the medically used terms may use in other way. Here treatment means actually it is not a treatment, we know it's a procedure, right? So they are telling about so treatment
Cannulas insertion.
administered previously. So that means the actually procedure administered previously. So carrying out a problem, that procedure they have given taking blood. Problem already explained there. And we know that why, what was the problem? Cannula, collapsed vein, led to collapsed vein. So that we can understand that is the option. And negative reaction already we have seen appropriate equipment. They are not telling anything about that in this.
Yes,
Let's move to today's final question. 30. Question number 30. You hear a doctor talking to a teenage boy who has a painful wrist. Okay. Now, the doctor wants to establish whether. Whether means yes or
to
no.
know.
Yeah, yes or no. Wanted to confirm something, right?
Yes.
Yes.
What he has to confirm? Let us see the options. A fracture may be misaligned. Option B, the swelling may be due to sprain. Option C, there may be more than one bone affected. So he has, the doctor is a female person, female voice. So she has to establish whether it is misaligned or due to sprain or more than one bone affected. Now listen the audio.
Question 30. You hear a doctor talking to a teenage boy. It's a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right, well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you described. I can't feel any other fractures. But you'll need an x-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
Okay.
Option A, ma'am.
You have to,
C.
why? You have to explain.
A.
You have to explain. Why did you choose A?
Both the bones are maybe misplaced.
Yes.
She's using the misalignment in other way, misplaced.
Yeah. One option was that sprain. Okay. My mom says I have sprained it. Boy is telling, and what the doctors reply. But contrast word is given there. So she is disagreeing. I don't think your mom's right in this case. See, this is also a negative expression. I don't think your mom's right in this case. That means sprain is not the reason. Next. I suspect you have broken what's called scaphoid bone, telling about a particular bone. So we can say that other option which is telling that more than one bone is affected is also not an answer. I'm telling that here classic injury. It's a classic injury resulting from what you described. I can't feel any other fracture. If she's again telling I can't see any other fracture, but you will need an X-ray to see. Yes, that is establish whether you have given there. Need an X-ray to see. Okay, to confirm. Okay, what? Where the two ends of the bone are. Okay, telling about only particular bone, so it is given singular bone, not bones. So we can understand that only scaphoid bone is affected or fractured here, and she wanted to see where the two ends of the broken bone. Okay, if they are not meeting up properly, that means not aligned. Let us see. Here you can see, to establish, it is given that to see again whether, if they are not meeting up properly. Misaligned means not meeting properly. See synonyms, and in synonymous language how nicely it is can be applied here. Due to sprain, already we have eliminated that because doctor is telling that that's not the reason. She doesn't think that it is the reason. Again, more than one bone affected, we have seen that only one bone. She's telling about the scaphoid bone. Hope it is clear to you.
Yes, ma'am.
Thank you, ma'am.
Yeah, it's already posted in the from those
I
who
have
want.
seen your class in YouTube regarding lexical question. Your class is very nice.
Okay, I told you that in the previous class also. You are also welcome to do this one. Okay, we are all the student faculty. Everyone will get the chance. If you are ready to do, you also can prepare some PPT and present it. Okay, like you are doing the discussion. Can we close it now?
Thank you, Father and all admin panel members, and thank you very
Thank
much.
you.
Thank you.
Bye.
Thank you.
Thank you.
Bye. Thank you.
Thanks everyone. Thank you for the training, Joseph.
Thank you.
All admin members.
Thank you.
Arya, thank you. Everyone.
Thank you, Rani Chechi, for the wonderful session.